Namaste, I am Dr. Dheeraj. Today I am going to talk you about a topic which is very popular and common, exercise. We all know for diabetic patient exercise is very beneficial. But what type of exercise and how much time you should do exercise in a day? That we will discuss today. What type of exercise helps in diabetic? Commonly people used to do walking, jogging, that type of exercise. This comes under cardiac or aerobic exercise. While walking or jogging, your heart rate increasing, so normally your blood circulation will improve. So walking and jogging or swimming, that type of aerobic exercise very good for your heart, cardiovascular system. Little bit calorie burning also happening, so it's good for diabetic also. But resistance training is very good for diabetic. You work your skeletal muscles, especially your calf muscles, gastrocnemius, or your biceps, trapezium. So while working those muscles, your insulin sensitivity will improve. And while doing a resistance training, what happens, it's very interesting factor. Without insulin, the glucose can enter inside the muscle cells. Regularly you are doing resistance training, your muscle size will improve, so more glucose can store as glycogen on your muscles. So there is a glucose storage in our body in the form of glycogen, so mainly store on liver and our muscles. So your muscle bulk is increasing, so more area is there to store glucose as glycogen. So that's a way resistance training helps you. So no need to go for a gym or no need of any fancy equipments to do this resistance training. You can do yourself in your house. For example, push up, pull up, or squats. This kind of exercise are very good for controlling diabetic. So I will do a short video on that, simple exercise for diabetic. How much time you should do exercise in a day? WHO says 150 minutes in a week, 30 minutes per day, like 5 days. It's a minimum time duration for diabetic patients. I remind you one thing, if you are a diabetic patient, before starting exercise, consult with a doctor. Dhanyavad.